Hello, and welcome to this short film about the European Surgical Outcomes Study, or EuSOS. My name is Rupert Pearse. EuSOS is only as good as the patient data you can collect and return to us, and the aim of this film is to briefly explain how we'd like you to do this. Today I have brought you to St Bartholomew's Hospital in London to show you how we're collecting the data here. The key points about this film are to show you which patients to include, which data to collect, and one good way of collecting the data. The EuSOS cohort week will start on April the 4th and will collect data on all eligible patients who have surgery until April the 11th. We'll then follow up all of these patients for data describing their first admission to critical care, which may happen on the day of surgery or many days later. We will continue to follow all the patients up until hospital discharge for data on hospital stay and mortality. However, the maximum follow-up period will be 60 days. So the final day of data collection will be June the 10th, 2011. In the operating room, each patient will have an operating room case record form completed. You can find guidance on how to complete the form in the frequently asked question document, which is available on the EuSOS website. This will explain many of the answers to the questions you could have. However, in some cases, for example with comorbid disease, we haven't specified any definitions on what disease the patient may have. We simply want you to give your view as to whether the patient has the disease or not. For blood results, we would like data on the most recent tests available. However, if the patient hasn't had any blood tests recently, then just leave the form blank. The separate follow-up for critical care admission is on a different EuSOS critical care case record form. In the recovery ward, we'd like you to complete the duration of time the patient spent in a standard post-anaesthetic recovery. Again, this is defined in the frequently asked question sheet. The remainder of this data will be completed during the follow-up phase by other members of the team, to the point of patient discharge and whether they survived to discharge. The critical care case record form is divided into several sections. The first on data describing the admission to critical care. The second, physiological data at 24 hours after admission to critical care, then 48 hours, and finally at the point of critical care discharge. The critical care case record form should be filled out for the first admission to critical care, however short. The EuSOS critical care case record form should be completed for every patient admitted to critical care after surgery. This may happen on the day of surgery or sometime later. If the patient is discharged before 48 hours, then some parts of the form will remain blank. You also note that some questions on the critical care form are similar to those on the operating room case record form, but should be filled out anyway for completeness of data. You will notice that for some data points, there are options of different types of unit. For example, for PaO2, you can include units in kilopascals or millimeters of mercury. We would like you to circle the relevant unit so this data can be included when your data is uploaded onto the internet-based data form. Other data points with this option include creatinine and bilirubin. And you'll find similar options on the operating room case record form as well. The operating room case record form and, if there is one, the critical care case record form need to be collated and checked to make sure that all relevant data is included.
Here's the EuSOS forms. There's one for critical care and there's the one for the operating room.
On each page of the case record form, you will find a place for patient identifiers such as name and date of birth. Once the bottom of the CRF is removed, this can be disposed of confidentially either by shredding it or in a hospital confidential waste paper bin. Once this is complete, your data can be uploaded onto the internet-based data form. They will check for any missing data points, including duration of hospital stay and mortality, before finally entering the data on the internet-based data entry system. I hope you found this film helpful. Remember, EuSOS is only as good as the data you can collect and send to us. So if you have any questions, feel free to get in touch. Thanks for supporting the EuSOS study, and good luck with data collection.